So my role is case manager in the gender health clinic, and that involves doing a wide variety of different things for the clinic, getting letters prepared for top and bottom surgery, making sure that everything's in line for the patients to be able to have that surgery done, which requires a physician's letter for medical clearance, and then also a mental health letter that they have to get from outside of Shasta Community Health Center. And sometimes that can be a little bit difficult, finding somebody in the community to do that. And also, often there's a financial barrier with that too. And so, trying to help navigate that. Whenever the patients have any concerns or something that comes up, they reach out to me on the cell phone and either by text, which ends up being very useful for them to be able to do it through text because of different anxiety levels and stuff like that. It's just an easy way for them to get their question out. And I can directly hit up one of the docs, whoever's their gender health clinic doctor, about their questions about the medications or refills, things of that nature. I help the patients with the legal process, getting them the forms for their gender marker change and their name change as well, and getting them hooked up with the resources in town that can help complete that as well. And then after the name change is done and the markers change, going to Social Security, going to the DMV, and helping with that process as well. What motivates me to do my work is the being able to help the patients overcome the barriers to be able to get care. That's a very personal thing with me, as I've gone through some of my own stuff, and having somebody to help navigate that when you're suffering anxiety or depression or other things are happening and you just don't know what to do, or getting the motivation, being able to have just that one person there is a huge catalyst in being able to get the ball rolling in the right direction. And so what really motivates me is seeing how much that kind of a service helped me in the past, and being able to give that back to the community. The mission of the Gender Health Clinic, aligning with Shasta Community Health's own mission statement, is absolutely serving the underserved. There is no place in this area that provides the type of care for gender health like we do. To be able to get even the surgeries, they have to go all the way down to San Francisco right now to have any of that done. But just to see a doctor, to be able to get the hormone replacement therapy going, being able to have a BHC there on site at the appointments to be able to talk to if they don't have their own therapist established in town. Like, it's serving the underserved. It's the people who can't afford to either get these things or don't have the resources to be able to start this process to really feel like themselves. And one of the greatest things about Shasta Community Health Center is that mission statement is serving the underserved, and it's very much in this population that ends up being the case with our patients that suffer with gender dysphoria. And so I see the values of the Gender Health Clinic aligning very much with Shasta Community Health Centers.